Hi, my name is Greg Felt. I'm Director of Public Health in Sheffield. So you'll have read that this place is in lockdown, that place is in lockdown, the rules in this sector or that sector have changed and you can't keep up. I can't keep up. I think a week or so ago there were somewhere in the order of 170 pages of new guidance and guidelines, all of which you will clock there are discrepancies between the different bits of guidelines. So this is a short piece about cutting through some of that to get back to the basics. Through all of the complexity, all of the nuances between all of the different bits of guidance, the core things remain. The things that make most difference to reducing transmission of the virus and protecting yourself and your loved ones and the city are these in order. If you have symptoms, no matter how mild that you think are coronavirus, stay at home, go home, stay at home, get a test, self-isolate. If you're identified as a contact of a case, you must isolate, and we'll come back onto that at the end. The really simple hygiene stuff, wash your hands, keeping your distance, wearing a face mask, all of those things collectively make a real difference. Bubbles and social contacts and the rule of 6. Basically boiling down the complexity, the more opportunities, the more contact you have with other people, the more opportunities there are for the virus to spread and accelerate into new groups. So I could have 5 people in my house today, a different 5 people in my house tomorrow, a different 5 people in my house the day after that. That can be quite loose, and put simply, the more networks I've got, the more opportunities there are for the virus to accelerate and spread into new groups, and that speeds up the transmission for the city and takes us closer to a place where government may impose a lockdown on us, which is one of the things that we want to avoid. So you define your circle and define it quite clearly and quite categorically. It's the chains of transmission that we're trying to avoid, and the more that we can lock down, to use a phrase, the chain of transmission, the more that we can not reconnect chains of households together. I'll be fine, I'll only get mild symptoms, I'll be fine. Well, yeah, you might be, and that is a message that I hear a lot, particularly from young people. The reality is that most will be fine, but older generations might not be, and what we're seeing in Sheffield is what we're seeing elsewhere. The virus is beginning to get back into older groups of the population, and there have been a number of admissions to hospital over recent weeks. So this remains a dangerous respiratory virus. It's really easy to spread. You've seen what can happen with 1% mortality. That's not a trivial number. And even on young people, we're becoming more and more cited on this phenomenon known as long COVID. People who have really mild symptoms of COVID when they were first infected are having very long-term, as long as we know thus far, but much longer lasting and very debilitating symptoms. This is known as long COVID, and again, it's seeming to affect young people as well, and something that clearly we'd want to avoid. So if you know of, if you're worried and you don't want to catch COVID, you know what you need to do to protect yourself and others. Wash your hands, keep your distance, wear a face mask, act like everyone else has COVID. So and if you act like that, then you minimise your chance of becoming infected. So isolation is a hot issue at the moment. So if you become symptomatic and if you test positive, you should self-isolate. We know lots of people don't, and that's the single thing that we can all do to reduce the chain of transmission. Just a few thoughts. Self-isolation in the context of having symptoms is different from being in lockdown. Being in lockdown, you can still go out, you can still get your shopping because you've clearly got to eat. Being in isolation with symptoms does mean being in isolation. So, and it may come to us all at a time when we're not expecting it. So be prepared. Have a plan, know what you would do if that happened to you. Probably pays to have some food in the house. And plan in advance and ensure that you've got some way of getting food supplies, medical supplies, etc. It is the thing that we can all do to minimise the riskiest bit of the transmission chain, and that's when, if you've got symptoms, that's when you're most likely to pass it to others. So being in isolation does matter, and does save lives. So throughout all of the complexity of all of the guidance, you can really easily cut it back to the following 4 or 5 core principles. Stay at home with symptoms, get a test. If you're a contact, stay at home, wash your hands, keep your distance is by far one of the more important ones, and have a plan. If you are asked to go into self-isolation, have a plan. So all of those things are the things that cut through all of that complexity. One last thing, the frequently asked questions that's available on government website is probably the best and easiest place to look for what you can and can't do. Again, it cuts through all of the complexity.